for our debrief. Good afternoon, fellow citizens, and welcome to the COVID-19 Communications Center daily 4 o'clock update around COVID-19 in Namibia. This afternoon, we are joined by colleagues from the Ministry of Health and Social Services to fully delve into the topic around the coordination of quarantine and isolation facilities as you enter the country through our different point of entries. To join me to discuss that, I am joined by Ms. Philomena Okorus, who is the Director of Health, Information and Research. Thank you very much for joining us. I'm also joined by Mr. Benson Tomwa, who is the Deputy Director of Primary Health Care. Thank you very much for making the time and to join us. So, especially around the discussion of points of entry, we would like to understand, and the viewers and listeners would like to know, what is the steps taken when someone who is presumably a Namibian citizen is returning back to Namibia and would like to then come back to the country? What is the procedure from point of entry to quarantine or self-isolation? Perhaps I can start with Ms. Okorus.
Yeah.
Yes.
Thank you, DM, for the question. If a traveler, in particular a Namibian, is arriving back into country, the first step at the point of entry is the traveler has to go through screening. So there is a health questionnaire, COVID specific, that you have to complete to give us a brief travel history, as well as informing us whether you are having any signs and symptoms related to COVID. So that history is taken, a form is completed, and on top of it, based on which port of entry, there might be a thermoscanner where the person's temperature is taken, or we are using a thermogun also to measure the temperature of the traveler, because fever is one of the cardinal signs of COVID-19, apart from the flu-like symptoms, coughing, difficulty in breathing. So once the person has arrived in country, that's the first point of assessment that is done. So after that assessment, the next step is all the travelers arriving back in country has to go through a supervised mandatory quarantine for 14 days. So when we talk about quarantine, it is basically restriction of movement for a person that might have been exposed to a pathogen that might cause an infection, in this case, COVID-19. So for 14 days, why 14 days? The incubation period for COVID-19 is about 14 days. So from the last day that you might have been exposed till you might present with signs and symptoms might take about 14 days. So that's the period of quarantine. So what happens is supervised quarantine is, there is a rapid response team responsible for supervise is monitoring throughout the period you are being monitored, signs and symptoms. Are you developing signs and symptoms, COVID related? Your temperature, is it changing? So you are put in a facility and supervised for 14 days. And those who present with signs and symptoms is managed differently.
Okay.
Yeah, so that is basically from the point of arrival and the quarantine for 14 days. And after 14 days, the 15th day, if you do not present with any signs and symptoms, then they are being released and issued with a certificate that you successfully completed a period of quarantine, supervised quarantine.
Okay.
That is what is happening.
All right. Perhaps, Ms. Ntomo, you can talk about what is this difference then between quarantine and self-isolation or isolation? How do we differentiate between the two, and which one aims to ensure that one does not pass on the virus should you have it to other people?
Thank you very much. I'll start with quarantine. When we say quarantine people, are people that we suspect, or people that are coming from risk countries, people that has been in interaction with somebody who was found to be positive.
Okay.
These people, importantly, have to be quarantined, as she said, for 14 days, meaning that they are taken away from the community, the society, keep them in a place where they will stay for a period of 14 days, as mentioned, monitoring the signs and symptoms. That is quarantine. Now, isolation is a situation in which somebody has tested positive, and he has to go through the medical procedures. These people are then isolated to the isolation area where they will be attended by medical professionals. And in fact, as I said, this will be the situation of people that are sick. They are completely isolated and treated.
Okay, so we also understand that there are some people at points of entry who have come into the country or would like to come into the country, but either they have been turned away or they are told that the facilities are full. Could you speak a little bit about that? What procedures are then taken for people in such situations?
We receive information of people, could it be Namibian, say in this case Namibian, returning home. We will receive this information through the embassy, if they are in a particular country, and is facilitated then by the Ministry of International Relations. It is a relevant ministry to inform us how many there are, when are they coming, what flight are they using, which route as well, and then preparation starts with us. If there are 200, then we have to make sure that 200 space is available for those people when they come into the country. In any case, we haven't seen or encountered a situation where people are said they should not come because there is no quarantine. If we talk about maybe delayed for a day or so while we arrange, that could happen. So every Namibian who is outside, arranged to come back. According to the regulations, they have to come back and the arrangement is done for them to be quarantined for 14 days. As they are assumed to be coming from risk countries. And it could be Namibian, or maybe we talk of other people who are coming into the country. For example, because we should look at this. Points of entries are ground crossing. You have airports, you have harbors. So people coming through all those channels will have to follow the procedures and they will have to be quarantined. So it's like everyone who gets into the country, could be a Namibian coming from outside, you are subjected to 14 days quarantine. To monitor, as mentioned, the possibility that you can develop symptoms. Within 14 days, we can know this person is free or these people are free to join the community.
All right. Thank you very much, Ms. Antoma. Ms. Okoris would also like to know how many quarantine facilities do we have in the country? What is their capacity? And so far, is it being filled up? Are there challenges around people who might not be able to be quarantined, or what is the situation looking like?
Thank you very much for the question. So around the country, in all 14 regions, points of entry, the regions has been mobilized and they've identified facilities for possible quarantine. So as we speak, we have about 65 facilities with a capacity of 1,500 plus. So at the present moment, we do not have 1,500 people being quarantined. So the facilities are there ready to be utilized to quarantine returning Namibians or travelers. So the capacity, it is available. So it is not full to capacity at the present moment.
Okay.
Yeah.
So if we have people in, let's say, self-isolation or in quarantine, and this can be a question to the both of you, and they break some of the state quarantine procedures or self-isolation procedures, what are the repercussions to individuals who do that? What are the consequences?
We are working, we are using regulations. And on top of that, we have Public Health Act. Let me state it clearly. According to Public Health Act, if you introduce or infect a person or people knowingly, it's a crime. You have violated the law. Infecting people knowingly, it's against the law. So if you are quarantined, the reason why you are there is to be isolated. Nobody knows exactly what is your status until 14 days. And you decide, you run away. That should be dealt with. With these regulations, as we see, you will be charged an amount not less than $2,000 or imprisoned. It's a crime. It's a crime to violate that law because it can culminate into infecting other people. That will cause more death than if things were taken into the right procedures, finish the 14 days, be released, and join others.
Thank you, Mr. Ntomwa.
Yeah, the
Yes.
key objective for quarantining or isolation of people is to contain the infection. And it is something that needs to be taken with all seriousness, that we have to protect the nation. So if you are put under quarantine, it's to abide by the rules and regulations, because it's only for 14 days. And it's to protect you and your family and the nation at large.
Well, Ms. Okurus, now how do you determine, what are the modalities put in place to determine that person A is for self-quarantine, person B is for self-isolation? How do you make the distinction as officials?
When it comes to quarantine and isolation, as mentioned earlier, isolation is for a sick person. The case is confirmed. You
are positive.
You are positive. You are tested and you are positive. That means you have to put under isolation. So to protect, for you to be managed and also to protect the rest, or to keep from spreading. And when it comes to quarantine, as mentioned earlier, is a person who is suspected, is not positive, but you are coming from a high-risk area. So you need to be observed for 14 days. And with the new regulations, it's whoever comes into the country needs to be quarantined. So
Now-
yes, you have to be put under mandatory quarantine where you are monitored.
Now, in this quarantine, is this person by themselves? Are they able to interact with other people in quarantine as well? Or how is it like in the facility?
At the facility, when you are quarantined, the facilities that we are identifying to quarantine individuals, the room is mostly self-contained. So, and then you take care of yourself in the room. And when it comes to meals, you observe the social distancing. You are not mingling with other people, so the social distance is there. So to ensure that I'm not transmitting the virus to another person, or I'm also not getting from another person, even though we might arrive as a group in the country, we don't know the status of the next traveler. So it's for yourself, to protect yourself and to protect the other person as well. So social distancing is being observed, and you are not sharing a room to say, I'm sharing a room with somebody I just met. So everyone is having a self-contained room. So that's the way to prevent, because as I mentioned earlier, the key objective is to keep the transmission amongst people and also to bring it in. Yeah.
All right. Mr. Ntomwa, there have been concerns around the hygienic state of some of these facilities, or how people are at the facilities. Can you tell us a little bit about that? How is the state? Should there be a concern around the hygiene of these facilities?
Thank you very much, because that question I'm directly involved in the inspection of these places and certify them fit for human habitation. Well, what we have been doing is that a place is identified, and then the team of health inspectors are sent there, not just to walk through, but to inspect, ensure that basic needs are there, such as water, as electricity, the ventilation issue, the lighting issue is there, self-contained, so to say. The toilet and the bathroom are there in that room, so that the quarantined people cannot move around and mix by using their basic facilities. Right. When that is done, then the team responsible for quarantine will then join us. This team comprises of surveillance, case management, and social psychosocial, which are social workers. The social workers' responsibilities, again, is to make sure that people are not put or say in a place that is not conducive for human habitation. Then after qualifying that, we move people in there. We don't just dump them there. We talk to them, the situation we have, and should know in the first instance, people were so agitated. They are starting, I'm going to be quarantined for 14 days. How will I live and so on. We receive phones now. We communicate with them. They are happy. The space, the place where we put them, is okay for human habitation. So the first thing, as I said, is for us to qualify it. We don't just go open, there you are, go in, this is your place. No, they are human beings. And as a health sector, we are also very cushioned. The fact that we cannot be trying to prevent another disease and cause another one. If you put people in an environment that is not conducive for human habitation, in fact, you are trying now to bring in some conditions that can culminate into illness. So that we are very, very careful on. And the procedures, as I said, is taken. I have been part of the group that inspect and certify this place is fit for the purpose we are now trying to implement.
Thank you very much. Would you like to add anything, Ms. Okurus, around that? The hygiene of the facilities.
Yeah, he said it all. Basically, it's ensured that the place, in fact, the place should be such that you yourself can live there. So that's why the ministry makes sure that whatever the basic needs are addressed. And not only the physical facility, the cleanliness, the psychosocial part is very critical. That's why the social workers are on the team, and continuously they are calling individuals who are under quarantine. Even though the facilities, the health workers like nurses are located, the psychosocial part is important, and there is always communication happening between the social worker and whoever has been quarantined for the entire period of 14 days. So you have that contact with them.
Okay.
Yeah.
One last question before I give over the media to ask any questions they might have is around really, we have seen reports that some points of entry have been opened, especially in the northern part of the country, around Angolan citizens looking or seeking medical treatment. Is this the case? Is this not the case? That some points of entry might have been opened, and what facilities then might be there at this points of entry to accommodate some of these people who might be seeking treatment from Angola?
Provisions are made. It's arrangement of, in a situation like this, there can be arrangements of the two member states, as we are a SADC bloc. And in some instances where there will be people seeking for medical help on the other side of Namibia, this is received, this arrangement receives attention from the regional director of that particular region, and then arrangements are made that are in line with the regulations, observing all preventative measures in place so that such arrangement is achieved, should it be needed.
All right, Ms. Okurus, nothing to add?
Nothing to add.
All right. Are there any questions from the media practitioners here today around quarantine facilities, self-isolation issues? I believe. Are there any questions from the media? All right, we have one over here. Yes, ma'am.
Good afternoon, Jemima Pierkes, Namibian Sun newspaper. Roughly 2 months ago, some Chinese nationals arrived in the country and they were also instructed to go into self-isolation. Do we know where these people are? What are the developments? Thank you.
All right, thank you. Are there any other questions? So we just take them as a cluster? All right. The question around that a couple of months ago, Chinese nationals came into Namibia and they were asked to self-isolate. Do we know where they are? What their status is? Is the ministry following up? Any of you?
Yes, before the state of emergency, the procedures were not only the Chinese nationals, but whoever was arriving at the ports of entry, screening was done. And for all the travelers that did not present signs and symptoms or did not have fever, those were advised then, because that was the protocol, to self-quarantine for 14 days. And when they were self-quarantined, the addresses were taken. And the surveillance officers were continuously in contact with them, monitoring them to see whether there are any changes. And after 14 days, they were also declared free, and then they could go in their communities. So as we speak, I'm not aware of any Chinese national in particular. Specifically that is under self-quarantine.
Okay, and yes, sir.
Yeah, just to add on that one, self-quarantine. We have our SOPs extend up to where we have to have a procedure in form of a form that has got procedures put in place. Say if we are hit severely, we will start seeing that issue of self-quarantine because we may run out of space. But now, people are not just saying go self-quarantine yourself. We still have to look at certain basic things, needs, that we can say this person can stay for 14 days in this place while we are monitoring him. We do not want to say, or we don't operate on basis of go and self-quarantine yourself. That's all. Now, we will make sure that we know where that person is, under what condition is he living, because there are some instances where when that person will need medical help. So we should be in touch with that person. Yes.
So you do a constant follow-up to then monitor.
That is our part, because we are talking about prevention. We are talking about social distancing. We are talking about avoiding people interact with the community while they have a condition, a query, to say this person may be sick, he is not sick, she is not sick, but may be sick. So that entitles us now, as a Minister of Health, to ensure that that person is monitored, strictly monitored.
Now, Mr. Thomas, some are of the view, or we have heard that some people's symptoms do not come up after 14 days. It might take even longer than that. What provisions have then been put in place for those who might be asymptomatic even until on the 14th day, but might develop symptoms after the 14th day? After this person either leaves quarantine or stops self-isolating, does the surveillance team continue monitoring, being in contact, or what is the procedure there?
In fact, when people are taken out of quarantine, they join the society, they are educated, they have information. They had been there. When they are in the quarantine, they are not just sitting there. We continuously give them information so that they know already. In fact, they're qualified. They are more informed than some of other people who haven't been there. they will exactly know what to do should anything happen. So the theory that after 14 days, one can still be not showing symptoms, well, that is another thing.
Okay.
But in this case, we play a preventative measure. And as far as we have educated this person, he is working knowing that what to be done is this and that. Yes, if you have symptoms that falls after, it comes after 14 days, you know what is COVID-19 signs and symptoms, and what to do should you encounter such kind of signs and symptoms. Yes.
Thank you. Are there any other questions from the floor? Any questions? All right, there are no questions from the floor, but there are some questions from our viewers specifically. They would like to know, for argument's sake, should they be in a particular region, is there a list of quarantine facilities where they are and how they can be accessed should somebody want to access them?
Yes, the regions, all of them has got quarantine facilities. And, you know, as we mentioned earlier, at the ports of entry, they will be met by health professionals who will do screening. And then those ones will direct them to the places of the sites where quarantine will take place. So the health workers on the ground in every region will direct them.
Okay, there's also another, oh yes.
Yes, let me add, with the general population, you see, every single region have got a regional
Direct.
management response team. This is now not going to include only Minister of Health. It's a regional arrangement. The part of information dissemination is fundamental. So each region have to ensure that the people within their region have enough understanding of the problem. What should happen if I have symptoms, if I don't feel well? They may not choose, I want to go to be quarantined. No. They will have to indicate, and the medical people will intervene to see what should be done with these people. People are not choosing, I want to go for quarantine. No. There are procedures that make someone, or us as Minister of Health, to qualify someone. This should go now for quarantine. This one we should isolate. Yes.
And what about situations where someone feels that they should not be quarantined but self-isolate? Does a person have that choice to decide whether one or the other? Whether now they don't want to be quarantined at the facility, they want to be monitored from home, even though if they've been exposed to the virus and have not been then determined to have the virus yet. Is that a choice, or is that mandatory that they follow the protocols of the Ministry of Health?
I think we talked about mandatory quarantine.
Yes.
If you, for example, you are in Namibia returning,
Yes.
yes, some will say, can you take me home? I am going to do ABC. I have a place. For sure, we don't prioritize that.
Okay.
Because ours to have total prevention of the entire community. And ours is to say this person is from a risk country and the possibility is high that he or she has been in contact with someone who is sick. So actually we may think of us to say we isolate this number of people. Or if it's an individual, we are going to, to quarantine this person. Take him from the community and quarantine him for this period of time to monitor the That is of interest for us. Not either to say, otherwise many should have been at their houses. They come back, others are coming from Europe, they have houses, they have even, basic needs if we go for inspection, but that we don't prioritize. We will have to quarantine these people, monitor them for the period, as we are saying, and then release them. We are sure that the safety of others and them is assured.
In that regard, so the choice is really not in their hands. It's mandatory whether they like it or not. All right, there's also a question around whether those in quarantine have contact with the outside world, whether they have visitors by their relatives, and if they can contact them. Is that a possibility once in the quarantine facilities?
Once in the quarantine facility, they have not the physical contact with families, but they have access to Wi-Fi, internet, and so they are not cut off from family members. But it is, again, their choice. Some prefer not to contact their families. They contact the social workers, but others prefer to be on WhatsApp, internet with their families, but not really physically until they are clear.
So there are no measures to restrict that type of interaction with their family members. Should someone want to come visit them or want to come drop off something for them, what are the procedures there?
We do not promote that. The reason for quarantine, I repeatedly say, even the relatives, what we observe, they would like to see that person when it's after 14 days. For themselves, their own protection, and the protection of the fellow relative who is quarantined. So we do not have a situation much where people want to go and see the child, and see the mother, and see the father, because I think education on this COVID-19 has been so spread. People now understand. This is a pandemic. It's not like we say it's localized in a country or in SADC region. It's all over the world. So the wave is the same. We see people now understanding this. I will wait for my child for my mother, father, until 14 days is done. Then they can happily meet. We do not have such persistence of people persisting, in fact, to visit their lovely one in quarantine.
All right. And my last question is around isolation. There is a question around when someone has then tested positive and they've been isolated, the issue of contact tracing. What is the immediate procedure? Does this person then give a list of people they believe they've become in contact with? And then what does the team, the surveillance team, I believe, or the contact tracing team do right after that?
Yes, once a case has been confirmed, it is like a natural procedure that follows. So the immediate contact, the family members, the friends, the health workers. So it starts like the core, and then you have to get the list of whoever you remember was in contact with you. And then it is also classified as the high risk contacts, the medium risk contacts, and the low risk contacts. So if you are very close to the confirmed case, you are considered as high risk, maybe the family members. So immediately contact tracing is starting, and then the people are being followed up, screening is done, and being monitored also for that 14 days to see whether they are presenting with any signs and symptoms. And when contact tracing is done, it's not just the screening, but education is key. Education is key, information provision is key, so that they will know what to expect, what to look out for, and where to go for assistance, and numbers are available. We have the hotline that is functional 24 hours, 24/7. So the 0800100100, that's a lifeline that is open. So if you have a need, you can call that line and you will be assisted with, and also be referred to where you can get assistance. But contact tracing is something that is very key in the response. So the rapid response teams are sent out and they follow up with the community for the contacts in the community wherever they are.
All right, Mr. Ntoma.
Yeah, let's say we take an example now, we have locked all the regions. In the last lockdown, we are still in there. We have not seen around the regions isolated any case. Per se, if we would have isolated a case in one region, the first thinking is that how many people could have been in contact with this person? The immediate family members who are living with it are all now going to be contacts. They have been together with the sick person for quite a while till the symptoms come. Not only those ones. What's this person's habit? Maybe he's going for a gym, it's a team of people, playing football, a team of other colleagues. Those behaviors, we have to go that far. In fact, to ensure that control and total prevention is achieved, the element of contact tracing should be practiced to the highest. That will enable you to isolate all those that have been interacting, and there are possible suspects that maybe they should have infected by that person. The more you widen your area of contact tracing, that is, the more you will have the probability to contain the disease. So contact tracing is very, very important. If you have at least a high percent of your activities to trace those who have been in contact with a sick person, then you are totally minimizing the probability of widespreading of the infection. Yeah.
All right, thank you very much, Santoma. Any final words from you, Ms. Okurus, as we conclude our discussion this afternoon?
Thank you so much, dear. The final words I will say is, it's only when we join hands in preventing, the spread of COVID-19 that we'll be able to make it. So the lockdown that has been extended, everyone should play his or her role in the lockdown to say, maintain the social distance. Whatever preventive measures that are in place, the cough etiquette, when you are coughing, make sure that you cover your mouth and nose. Wash your hands all the time. If you are not accessing soap and water, use a sanitizer. Protect yourself and protect the next person. Let's be all conscious. Then together as a nation, we'll be able to curb. And once I know I'm under quarantine, the rules and regulations, the directives that has been...
You go out in groups of 3 maximum. 3 people maximum to go out and do these activities, because this will ensure that we do curb the further spread of COVID-19. Join us tomorrow morning as we discuss around the zoning of the different regions, around the extension of the lockdown, when we are joined by officials from the Ministry of Home Affairs and Safety and Security to give us more information on how the modalities will go around extending the lockdown and the different entry points that people will be utilizing should there be an emergency, should they want to travel. So do not miss that discussion so that we all have the information clearly laid out to us when we want to travel or around the modalities of how our regions are zoned to ensure that the lockdown is extended to the whole country. Thank you very much for continuing to be with us, to viewing our broadcast here at the COVID-19 Communications Center on the different radio, TV, and social media channels. Continue sending your questions through our covid.nam@mict.gov.na email, as well as using the Ministry of Health and Social Services hotline, which is 0800 100 100, to ask any COVID-19 related questions and queries. Thank you very much for being with us. Have a blessed day.